Hi, Clarissa Mosley from Calm Mind Psychology, and thank you so much for joining me in finding out more about this incredibly important topic of depression. So in this video, I will follow through and look at some of the other forms and subtypes of depression, like high-functioning depression, seasonal affect disorder, bipolar disorder that used to be called manic depression, and postnatal depression. So I made a reference before to another form of depression. This is more of a long, slow burn depression called persistent dysthymia, or also known as high-functioning depression. This is what we mean when we're talking about smiling depression. It's not that people are super high-functioning, it's just that they have the major depression, but they've had it for such a long time. It's often become part of them. So if you know this person, they might seem to just be one of those negative, sultry, low mood people that never seem to be very happy. If you are a person who's had this, you may get through life okay. You're not lying in bed all day. It's an effort. Nothing's really fun. You're not really enjoying anything. You might be using drugs or alcohol to sort of mask or cover or self-medicate these symptoms. You only need 2 of the criteria for major depressive disorder to have this diagnosis, but these symptoms have been present for about a year, and they do include the low mood. It feels like it will never go away. It's just part of your life, and if this has been going on for a year, you are probably well adjusted to it. You know, you'll be deep in the dark forest, and you won't be able to see the trees. This is just you trudging through life. You may have periods of happiness. So this is where the people can show up to meet the new baby or go to someone's celebration and look like they're fine and happy. This is why it's masked depression, the smiling depression. It's on the outside, they can show up. They're not so depressed or phlegmatic that they're in bed all day or, losing their bodily hygiene, but they are not happy on the inside. And doing these things takes an awful lot of effort also. They might resist going anywhere unless they absolutely have to. And of course, the feelings of unworthiness, of hopelessness, of low self-esteem, of being a burden on others, all of those things are present. Other variations of depression, you've got seasonal affect disorder, also known as SAD. This is, again, the same as major depression symptoms, but it only happens during winter, usually. There are some interesting people that might have it in summer. Most of the time it's in winter. It's in far hemispheric places where there isn't a lot of sunlight. We believe it's related to sunlight, and it's showing up often at the same time in the season. And then we've got what used to be called manic depression, now called bipolar disorder. In the depressive phase, same symptoms as in major depressive disorder, but there is in between manic phases. So you've got bipolar 1 and it cycles really high, like super high and really low. And it can be fast or slow. Like these cycles can take 3 months, they might take 3 weeks, they could happen over a week in rapid cycling bipolar. Then you've got bipolar 2. It's not as high and it's not as low, but it's still marked and it still interferes with the person's life. In the depressive phases, there's the weight gain, there's the lethargy, nothing gets done. But as the person moves up into the high phase, they're not aware. Again, when you're in these states, you often can't see the forest for the trees. But as they move up on their high, things start to happen. And by the time they're really near the peak, terrible things can happen. They could have taken out a loan and gambled it away. They've decided they want to start a new business and they've got all these people on board and they've withdrawn against a mortgage and they've got all these grand plans and bought all of this stuff. Maybe they've gone on a spending spree. Maybe they've gone on a drinking bender. Vegas is a great place for people when they're having a hypomanic state. There can be promiscuity. There can be an awful lot of damage done in the person's life, and as they come down off the high point, they can see that. Now, not everybody gets so high that it's devastating. You've got some really functioning people with bipolar who create and do a lot of amazing work when they're in their upswing. And this is why people with bipolar tend to resist medication, is because they want that high point. They just don't want the low point, which can be absolutely devastating for them also. And really important is postnatal depression, perinatal, postnatal. We've realized that the depression or anxiety can come on before the baby is born, but it's usually diagnosed within the first 4 to 6 to 8 weeks after the baby is born. It is really important that if you or someone you know has got postnatal depression, that you get help as soon as possible. I know it's hard. I've had kids and I've had postnatal depression myself, and you often don't realize that you have it. Again, you're in the forest, you can't see the trees because you're having 2 hours sleep and feeding a baby and you're busy and there's so much going on. Similar symptoms to the major depressive disorder, but they're often centered around the baby relationship. So a mother who's got postnatal depression badly, the baby can seem like a foreign entity that, they're either averse to or afraid of it, crying, wanting feeding, or hurting it. There's a huge distance between the mother and baby in that relationship in the early stages. And this isn't good for the baby particularly, because we know that if you want to have a quick peek into what is your risk factor for depression, having a mother who was depressed is probably one of the highest risk factors. That's not just because of the genetics, it's because of the things that happen in the mother-baby relationship. So when a mother's depressed and the baby's looking at mum, so let's say the baby's a couple of months old and it's staring up into mummy's eyes and the mum's face is like this. The mum, flat affect, the mum has no feelings, the mum is sad. And so the baby doesn't get that feedback that babies need, that cooing, the talking, the cuddling, the responsiveness. And so it can interfere with early development quite profoundly, and that can have lasting effect. Or if the mother is depressed or has a depressive episode as a child is older or is chronically depressed, then there can be a lot of learnt behavior from the child that comes out in later years as their own adolescent or adult depression. So a mother with postnatal depression will often feel that she's an absolutely horrible mother, that somebody else would be better at looking after her baby. There can be a lot of fear around the baby, a lot of worry, obviously not sleeping, but it's like when the mother gets a chance to have a nap, she can't. There'll be a lot of obsessive thinking often. There can also be anxiety present. It's quite common to have depression and anxiety following. You're quite frazzled. You might have obsessive thoughts, ruminate. 100% important that mothers reach out for help, or they are supported in finding help and are supported with as much support as possible. And the final kind of depression is premenstrual dysphoric disorder. So this isn't really depression proper because there's a whole mix of symptoms in there, but low mood is definitely one of them. So it's a little bit different from your average PMS, which is bad enough. I'm not minimizing it, where a woman will get bloating and tenderness and cranky mood. And it's probably manageable. The PMS is manageable. So you might be able to go to work and be nice and civil, but you come home and your husband's chewing loudly and you want to strangle him. That's a feature of PMS. Premenstrual dysphoric disorder is an absolute roller coaster. It can be a week or 2 weeks before the period. There is mood swings, there are anger outbursts. I'm talking arguing in the car park kind of anger outburst. There are low moods, there's depression, there's all the physical PMS symptoms, feeling panic attacks, feeling out of control. It's quite an astounding constellation of symptoms that has recently been classified as worthy of diagnosis and treatment. So if that's something that you or someone you know is experiencing, then again, that is absolutely worthy of going and having an assessment and checking it out. Now we're going to talk about treatments. We're going to talk about risk factors in the subsequent videos. So I hope that you'll stay on and watch through. But I also hope that you've enjoyed this in terms of assessing whether or not yourself or somebody you know might have one of these many forms of depression. So if you did enjoy this, please hit like, please subscribe, and please hang in there and watch some of the other videos I have in this series, because I've got some really interesting things to tell you. Okay, so shall we move on?